Hello, and I want to thank you for your interest in our hybrid or online EMT program here at Georgia Medical Academy. My name is Tom Camplain, and I'm the program director here at Georgia Medical Academy in charge of the EMT and the advanced EMT programs. And I want to take this time to give you a brief overview of our programs and what we have to offer. So our EMT program, it's a 25 to 28 week course, and people will say, why is it 25 to 28 weeks? Well, I say 25 to 28 weeks because sometimes there's holidays that pop in there. Like at the end of the year, we have Thanksgiving and Christmas, and sometimes those holidays can add time to the course. So depending on when you start the course, it may be 25 weeks or it may be 28 weeks in length. There's also 15 lab sessions that you'll need to attend. And the course itself is going to combine online learning with in-class lab sessions. And I'll talk about the lab sessions a little more detail a little later. And you must participate in at least 25 hours of internship in the pre-hospital setting. Now, 24 hours of that will be in the field where you're actually running calls and treating patients. And 1 hour of it, you'll be getting your orientation, getting you ready to go into the field. So the online class section, we utilize the Jones and Bartlett Navigate course management system, and I just want to give you a brief tour of that quickly. All right, to get there, we go to jblearning.com, and jblearning.com, you'll see once you go there, there'll be a section that says log in, and then we just log in, and I want to log in with my credentials here. And then once we get here, we'll go to Navigate Courses, and that'll pull up our courses. And I'm going to pull up one of my EMT courses since I'm talking about the EMT course. And it's a little bigger for us, and this is what it looks like. Now on the sides here, oh, didn't mean to do that. On the sides here, we have, since I don't have a lot of room in the window here, I'll have to show you in sections. Over here, you have a place for your participants. And let me switch my role to student so you don't see. Alright. So we have you can see all the other participants. You can see your assignments, forums, the quizzes, some resources, and your grades and your profile. Now, the main part that you're going to be utilizing is right here in the middle, and we start down here. Each section is labeled, tells you the section number and what you're going over and the due dates. Like here, your first 4 sections are all due on the same date. Don't get nervous because they're short sections, and I give you a long time to do them as well. So the first thing you want to do whenever you're in the course room, the online course room, is you always start at the top and work your way down to the bottom for the most part. So you can hit the start here, and you'll open that up in an Adobe Reader file, and it is a checklist of everything that you'll be doing for that section. And what I tell everybody to do is print that off and just put a check mark there as you finish it so that you know where you're at. Now, you'll have some things where you do discussions. You'll see a lesson outline that gives you an outline of the lesson. Right here, you need to read chapter 1. There's chapter PowerPoints, so if you like looking at the PowerPoints, you can download the PowerPoint and look at it. There's a case study. And then there's a case study assignment. And then there's flashcards you can look at. And then there's an interactive lecture. And let's look at the interactive lecture. And this window will pop up, and then you can just click on interactive lecture. The window's not quite big enough.
Emergency Medical Services, or EMS system, consists
but
of a
if you
team
can
of
hear,
health.
it's going to give you the audio, the lecture. You can turn the audio on and off.
Care professionals
but you
who
can
are
hear
responsible
that
for
she's
and
kind of
provide
telling
emergency
you
care and transport
information like I would if we were in a live class. And there's navigate buttons. Now there's a button that goes forward that's off the screen that you can't really see. And once again,
when you successfully complete your EMT course,
each slide gives you like a lecture, and then you can click on certain things to get even more information on, and that's how the lectures work. Now, and I'll go over this in more detail like in the first day of class where I'll teach you how to use it. I just want to show you just some of the highlights here. And the next thing is the ebook. Now, when you buy your book, you will get a hard copy book, but you'll also get what's called an ebook as well. And the ebook has an electronic workbook as well. So here's like the ebook and then the electronic workbook as well. And you'll complete all these exercises here. For the electronic workbook, and that automatically goes into your grade book, but you don't have to submit it. Now what I tell everybody to do is you work in the workbook until you make a 100 and then you submit the grade. Now it's not the same every time, so it's not that easy, but you should keep working at it, learn from it, and then move on. The whole point is learning by repetition. Alright, so that's the online course room. Now labs. Now the labs allow you time to apply the things that you learn in the online setting so that it gets you prepared for the real world setting, like whenever you go out to do your clinicals and then after you graduate and go out and get a job. Things that we'll do in the labs are we'll learn a CPR, we'll learn about patient assessment, we'll learn how to treat trauma patients and medical patients and how to give medications, how to utilize oxygen and use airway management techniques to help our patients. We'll learn how to extricate patients from vehicles and so on. Now your internship, like I said, 25 hours with 1 hour being in orientation. And also while you're doing your internship, it's more than just the hours. You have to do certain things as well. And if you can get all those things done in the 24 hours that you're actually in the ambulances, then that's all well and good. But if you do not complete all those goals, then you'll have to continue going until you do. For instance, as an EMT, you have to get 10 patient assessments. So if after you do 24 hours, you only have 7 patient assessments, that means you're going to have to go back and continue going until you get all 10 patient assessments. Alright, so the big question everybody asks is, how much is this going to cost me? Well, the cost is broken down into 3 sections. We have a didactic section, which is the online learning section. You have labs, and you have clinicals. Now the didactic portion is a flat fee of $997. The labs are another fee. Now the $997 will work out your payment arrangements with that, but your labs, you have to pay for your labs per lab, and you can either pay for your labs all at once at the beginning or you can pay as you go. Now the labs kind of work where we have labs on Monday night, we have labs on Thursday nights, and then we have labs every third Saturday. Now, like Monday is a 4-hour lab from 6 to 10. Thursday is a 4-hour lab from 6 to 10. And then Saturday is an all-day lab, so you have from 8 to 12 to do 4 hours, and then 1 to 5 to do 4 hours. Or you can do all day and get 8 hours in. So if you do the all-day session, it'll be $40 for that day, for a Saturday. Or you can do just 4 hours and do just 20. and you'll have to pay that before you come to lab. Now that means you get to schedule your labs. So you don't have to, you can either come on Monday nights, Thursday nights, or do the Saturdays. Now you'll have to do this beforehand, so you'll have to be in contact with us to let us know when you're coming, and you'll be able to sign up for that online with an online form, and we'll be able to keep up with you, making sure that you get the correct labs and you're placed in the right, with the right instructor, and you get the right instruction on that day. Now your clinical is free. There's no charge for your clinical unless you get to the end of the program and you have not completed everything. Now we do typically give a grace period that if the program ends on June 1st, we typically give a couple weeks their grace period for people to get things done, and we are human and we will work with you. But if after 4, 5, and 6 weeks you're still not finished with it, well then there's a fee, and that fee would be $50 a week to extend. However, we will work with you, but that only goes so far because there is a limit there. You'll also have to get a uniform shirt for doing your clinical, which is $25. Your book is anywhere from $230 to $275, depending on how it's shipped and where you buy it. We do have a discount worked out with Jones & Bartlett. We do not sell your main book, but you will have to also get a competency book from us, and that's a charge there as well, and we'll have that broke down for you. Now the other fees that we'll go over in class, they're just simple fees like if you're on a payment plan, if you have a late fee, if you're late, and so on. Those are just miscellaneous things that don't apply to most people, but we will go over them with you later. So the next thing is how to sign up. Well, to sign up, you can first you need to contact us and say, hey, I want to sign up, I'm interested, I'm ready to pull the trigger and go. So what you'll do is you'll contact us and we'll send you an online registration form that you need to fill out. And it is a requirement by the state office of EMS because we have to give them the information that's on the form. You can do it electronically and it comes straight to us, or you can come by the office and fill it out if you'd rather do that. And then you'll just need to either provide a deposit, which will hold your seat, or you can pay your tuition or part of your tuition, however you want to do it. Just be in contact with us and we'll work with you. Once again, my name is Tom Camplain, and we look forward to working with you. Hopefully, we'll see you in our next class. Please feel free to give us a call at any time, and we'll be glad to help you. Thank you very much, and you have a wonderful day.